Hello, my friends. Andrew Kornfeld here. In today's video, reporting to you from San Diego, California, I'm going to talk to you about Systema Health, our incredible company that is working with individuals who are both healthy and those diagnosed with chronic health conditions and helping them change their life forever. And it is a completely new approach to health. And I believe that this approach and this company will eventually have a profound impact on healthcare systems all around the world, because it's an obvious approach, it's an evidence-based approach, it's a science-based approach, it's a rational approach, and it's an innovative approach. And I'm excited to tell you about it. So real briefly, Systema came about from my journey with Crohn's disease. And I was diagnosed when I was 16 years old. And I went through quite the ringer, you could say, okay? And I was put on intensive immunosuppressive therapies, and at that point I was able to sort of get to a place of functionality. About 6 or 7 years into my disease course, I had a severe flare. I had never achieved remission. I was never quite right. And during this severe flare, I was faced with surgery and going on more intensive medication. And for the first time, I looked at my disease differently, because I had had an experience before where I had learned an incredible amount, and that experience was me getting a degree in neuroscience and psychology. And I learned about the scientific method. I learned about how to research different scientific principles, to look at the latest scientific evidence, and to understand really what was going on, but I never really had to do it and apply it to myself. I dove into the scientific literature, and I discovered that there were a myriad of different treatments for this condition that were ranging from medications, obviously, that I knew about, and a number of them that I hadn't even heard of, to integrative treatments, to those that involve lifestyle, diet, nutrition, supplements and herbs, everything ranging from different mindsets that you can have to hyperbaric oxygen. The list goes on. And it wasn't just as simple as cutting all the foods out of my diet. It was about being able to incorporate the right ones, and when I was eating, how I was eating, what was the texture of the food. And then specific evidence-based nutraceuticals and supplements and herbs proved to be extremely effective for me, and I attained remission from Crohn's disease. And there's a lot of other videos where we can go into that. But that's what inspired my journey. Systema Health has resulted from this journey and now years in the health coaching space and working with hundreds of patients with inflammatory bowel disease or Crohn's disease or ulcerative colitis, microscopic colitis, and indeterminate colitis. And what I discovered with my own protocol and then working with hundreds of people was that everyone required something different. And the more involved and the more engaged and active the patient of that condition is, in this case, inflammatory bowel disease, the better the outcome. And that's why we specifically designed a program to empower IBD patients, and now with Systema Health to empower patients of hundreds of different chronic health conditions and empower healthy individuals to promote wellness, longevity, and prevent chronic disease. Systema is a company that is rooted in neuroscience, and specifically the idea of neuroplasticity. And this is the belief and the idea, my friends, that human beings can go through profound change, and that human beings are capable of amazing things. And this is what we have now seen for decades in the human brain. And it cannot be underestimated. Our experiences that we have every day, they sculpt who we are and how we engage with them and our behaviors. So that's why when patients or other healthy individuals come into Systema Health, a lot of times we take a moment to understand what's happening and we help them to understand. And if you enrolled, you would understand the biology of your chronic health condition. You would learn about all of the different treatment options that are available. You would learn about all of the research on specific nutraceuticals or supplements and herbs that's been done, the strength of that research, what people are going through in live time, other people who have your condition. You're going to be part of a community of patients and experts who are, again, educated and designing and building their own protocols. And then the key here, one of the really, really important keys is collaboration with all of your doctors, your mainstream doctors, and if you decide to have naturopathic doctors or integrative doctors, it's time for everyone to be on the same page. And what you're gonna do is develop your ultimate protocol, and we will help you build that. And it depends on what you want. You are a unique individual with unique wants and needs and desires, and you are a unique biological specimen. You are a creation, if you're religious, you are a creation of God, and if you are more spiritual, you are a creation of the universe, and if you're an atheist, then you are simply an incredible human being existing. And you deserve the best, and you deserve something that works for you. And sometimes we get really stuck up on a diagnosis or trying to figure out exactly what is going on with people, because so many times these conditions, they present in mysterious ways, whether it's conditions of the gut or autoimmunity, okay, or even sometimes lifestyle metabolic conditions, or even conditions of the mind. All of this relates to one another. And in my experience, the missing piece from the healthcare system is a patient-centered, patient-designed program that literally turns you into a superhuman in regards to your chronic health condition and in regards to your health, and helps you move through the world, helps you collaborate more closely with your doctor, helps you to fight your insurance company, helps you to walk into your medical appointments knowing which drugs have the most evidence behind them, which ones have the most side effects, which ones have, again, specific research about your subtype of chronic health condition. It's amazing what happens. And there are practical tools in the program, like the Remission Master Plan or the Health Master Plan, the Adaptive Dietary Framework. These are non-dogmatic tools because we don't believe there is one way to do this. There are many different ways to achieve your goals and to achieve your state of health that you desire. And I just want to take a moment to speak to those who are suffering right now with chronic health conditions. If you have IBD, if you have IBS, if you have autoimmunity, other forms, including psoriasis or eczema or rheumatoid arthritis or lupus, if you're struggling with your weight, if you're struggling with diabetes or fatty liver disease or cardiovascular disease, if you're depressed, if you are struggling with ADHD, these are all conditions that are influenced by your environment that you are in, okay? And that is why one of the principles of Systema is to change that environment. And I just want to acknowledge that if you're in the midst of something, when I was in the midst of my worst flares, nothing mattered except getting healthy. Because every day I was trapped in my own body. And I know some of you are there right now. And I want to give you hope. This is an obvious, unique approach. It's not rocket science. And that's why I hope a whole lot of people copy what we are doing. Systema has several ways of addressing this. We have a foundational program called Systema Core. I work with people one-on-one in advanced coaching for any condition except IBD. And for IBD, we have a very specific program called Systema IBD, which is based on work with hundreds of people, and in my opinion, is the most advanced and effective program for inflammatory bowel disease in the world. I don't take on that many non-IBD clients, but I take a few every month. And if you're struggling with IBS, or if you're struggling from rheumatoid arthritis or psoriasis or a different autoimmune condition or a lifestyle metabolic condition, I want to help you and support you. And obviously the same goes with inflammatory bowel disease, what we have done for a long time. I believe in you. I believe in what you are capable of. And the reason why is because of how this program is structured and what it reveals about human nature. The ability of the brain to change and to take a systems-based framework and apply it to human health. A multi-dimensional, individualized approach designed by you, edited by us, and approved by your doctor, and then implemented by you. You will no longer be patiently waiting for your doctor to get back to you, sometimes after way too long. We will help you right now, and you will know what to do. And we will help you find the doctor of your dreams. We will help you work with your current doctor. We will help you build the most incredible and diverse medical and health team on the planet. We will help you change your diet in ways that work for you and still be able to enjoy so many amazing, delicious foods. And sometimes it's important to remember that food brings you joy, brings me joy sometimes. And sometimes it's important to be able to be free in what you eat. And sometimes it's important to listen to your body. It's important to listen to your body and be able to literally cultivate the superpowers that gives you. Because if you've been diagnosed with a chronic health condition, or you need to follow a specific diet, or there are certain things you can and can't do, that is literally your body giving you a signal that will help you live longer and better and stronger than actually a lot of people, and maybe even most of your friends. That you might be the healthiest one because your chronic health condition gives you superpowers. It gives you your sensor is more sensitive than just about anything out there. And you need to listen to that sensor because it will help you live longer and better. I didn't want to record a super structured video. I wanted to give you like a real, my experience of what Systema is. And we have a beautiful website. You can go to it, you can check it out. You can read all about specifically what we do. We have incredible blog posts there. We have an incredible micro course on inflammatory bowel disease, which is the most advanced micro course ever created. It's the most comprehensive. You will learn literally so much. And I want you to just know that there is hope. And I'm not just saying that. There's not hope for people who do not take massive action. And if you're in pain, if you are suffering, if you are not sleeping, if you are tired all the time, if you do not feel good, it's time to change your life. And seriously, give me a call. I can't promise you that I will be able to accept you into our programs, but I sure try to get everyone in as hard as I can. I want this approach and what I am doing and our mission to be accessible to the world. I don't care where you live, we can help. And with that, I am wishing you so much love, so much healing, so much strength, and have a wonderful day or evening. Over and out.